Assalamu alaikum. Greetings to all of you. Welcome to our child care channel, English version, series 2, newborn care. Newborn care, we are going to discuss in two parts. Today, we are going to discuss part 1. Newborn care starts with delivery. Delivery, home delivery should be completely avoided, and all deliveries should be done in a hospital setting. There was a time when there were not enough hospitals available wherein home deliveries were in vogue. But at present, all over India, most of the rural areas have primary health centers, and therefore, it is preferable that deliveries should be done in the hospital settings. It so happens sometimes that there is an emergency and the delivery occurs in the house or on the way. In such a situation, which is unavoidable, we should see to it that immediately after the delivery is done, with maximum hygienic precautions, the mother and the baby should be transferred to the nearest hospital for examination to prevent complications in both of them. After the child is born, the mother should feed the child in 2 hours of delivery, as I have discussed in details in the previous video. After the feeding is done, the child should be burped properly, which I will demonstrate to you. It should be burped in this way so that the gases are released. After burping, when the child is kept on the bed on the mattress, you should see to it that the child is initially kept like this and the face is turned on the sides in the first few minutes, like 15-20 minutes, so that if the child vomits out, the vomitus will go out and it will not go into the chest, causing pneumonia and other complications. After some time, you can make the child straight and make him lie down straight. You should see to it that the feeding schedule is strictly maintained as I had advised in my previous video. Tongue cleaning should be done every day with a wet cotton cloth. A question is asked to us whether the oil should be put in the nose and the ears, and the answer is a big no. No oil should be put in the ear and the nose. It may cause complications. Application of kajal is the second question which is asked to us. Kajal in a newborn baby can damage the cornea in the initial phases and therefore should be avoided. In Indian custom, in most communities, the child is tied and wrapped properly, completely. Tying it really does not help much. Only thing, it is easier to handle a tied child. Otherwise, it does not really help much. Few normal things I want to tell you, parents. One, a child when he is born, a mature child, full term, should have a weight of around 3 kilos plus or minus 250 grams. Height should be somewhere around 45 to 50 centimeters. That should be the length of the child. So many mothers come to us and tell us, my child is sleeping a lot. So let me tell you, parents, a child sleeps for 20 to 21 hours in 24 hours in the initial phase, that is the newborn period. So don't get worried if the child sleeps for 20 to 21 hours. He gets up only for feeding and then he plays for a while and he sleeps off. So many times we get complaints that the child is crying a lot and my milk is not enough. I have discussed this in details in the previous video. I want to tell you all clearly that the crying child, if it is immediately, say an hour immediately after feeding, it may not be because of the improper or incomplete feeding. It could be because of abdominal pain and many other reasons, which we call as physiological colics. In that situation, how would you know that this pain is not related to the feeding part, but it is because of the pain in the abdomen? First, the time. If the child cries immediately in an hour's time, probably it is not related to feeds. Two, if you take the child on your lap and put him close to your chest, he stops crying. And the moment you put him down, he starts crying again. That is one more sign that this child is having abdominal pain, which you must consult your doctor. But before you go to the doctor, you must give a special position to the child, which may help in warding off this pain. That is called as a prone position. The prone position of the child, the face on the side, this should be the position of the child. And it will help in reducing the abdominal pain, relieving the gases, and the child may feel better, which may avoid a doctor's visit. So many times, mothers come and tell us the child has not passed stool for 4 to 5 days. Let me tell you, these children, newborn babies, may pass 8 to 10 times in a day or may not pass a stool for 4 to 5 days. Both are normal physiological variations on breastfeeding babies. So basically, don't get panicky if the child doesn't pass stool for more than 4 to 5 days. But if it crosses say 6 to 7 days, yes, you must consult your doctor. If the child passes stool 8 to 10 times in a day, if they are soft, yellowish, no water in it, no blood in it, don't get worried. It is normal in a child to pass 8 to 10 times in a day, and you don't have to take treatment for the same. This child who is born immediately after birth will pass around blackish or greenish stool in the first or second day. After that, the stool color will change to yellow. As far as urination is concerned, the child should pass urine in the first 24 to 48 hours of delivery. After that, every day, 5 to 7 times in a day is a normal amount of urine a child should pass. There are certain conditions which the parents are worried about. They come to us and tell us that the child has a foot which is bent, which is called club foot. This club foot deformity is like this. So there is a simple exercise. Put your fingers like this and push the foot out. If you do this 25 times in a day in the both the foot, if it is a mild club foot, it gets relieved in few months' time. You don't need to go for further treatment like plastering and surgical interventions. If it is a club foot which is very much bent, then yes, you must meet your doctor. The other complaint which the mother comes and tells us, a female newborn baby is passing blood from the vagina. Parents, don't get worried. It's a normal phenomena in a newborn girl because the mother's hormones, estrogens, are being circulated, and that causes this bleeding in the children in the newborn period. And maybe after some days it settles down naturally. You don't need any medical consultation for the same. But yes, this child must have received vitamin K at birth because vitamin K deficiency can also cause bleeding from various sides, like the vaginal side, the urinary side, or bleeding spots on the body. In that situation, you need to consult your doctor. So many times when the cord is there, it falls off naturally. Please don't put powders on that cord because it heals naturally. After some days, when the cord falls off and there is pus discharge from there, or there is some amount of watery discharge, you must consult your doctor because that can lead to infection. There may be some amount of small granuloma which may remain there, which needs cauterization or removal, which is best done by your concerned physician. One more complaint which we get from the mothers is breast level engorgement. These babies have enlarged breast. Parents, don't worry at all. This is a normal hormonal changes in a newborn baby. So we have seen, especially these dies of grandmothers, they squeeze this breast to get out this milk, which is called as wit's milk. So please, this is a natural phenomena. This breast will settle down naturally. Don't do anything about it. So many times we have seen these guys have dirty nails, and when they squeeze, there is pus development in those breast area, and we need to operate these children to remove this pus. So please try to avoid this problem. Normally, in the ear, you may get some amount of whitish sticky discharge, which may be just sticking there, which is a normal phenomenon. Don't do anything, just clean it off. If there is a discharge which is foul smelling or a watery discharge which is yellowish or greenish, please consult your doctor. As far as eyes are concerned, you should not have any discharge from the eyes. If there is a discharge, a pus or a water coming out from the eyes, yes, you must immediately consult your doctor. There is a condition called epiphora in newborns, wherein you will have watery discharge for say 4 to 6 months. It is because of the blockage of your lacrimal duct. I will show you a simple exercise for that. And this exercise you all must do at home. Put your both the fingers, the corner of the this thing, eyebrow, and press it and bring it near the ala nasal. This you must do 20 to 25 times every day. See that your nails are small so that you don't hurt the baby. When you do this regularly, generally this blockage clears off and you don't have to worry much. If even after 6 months there is a watering of the eyes, yes, there is a procedure which is done by the ophthalmologist. Two important things I want to tell you all. One is jaundice in the newborn baby, which most of these mothers encounter because 80% of the babies get jaundice. It's a physiological jaundice. How it starts at day 3.5, it starts. At day 4.5, it peaks. And day 5.5 to 6, it goes down. This is a natural jaundice. But you must be careful in this situation if it's a pathological jaundice. So what is a pathological jaundice? That only a doctor can detect. So whenever a baby is born, blood group has to be done. If the blood group is different of the mother and the baby, the RH positivity, negativity, or ABO incompatibility, yes, there are high chances this baby will develop severe jaundice and he needs treatment. A common refrain is that, especially from the grandparents, you must give sunlight. Yes, sunlight do help, but then it is not the treatment. And these jaundice, if at all, it is very severe. It may damage the brain and cause mental retardation and other issues in children in future life. So please, when you see a yellow baby, don't sit at home, consult your doctor. One more thing you must remember, if the child develops fever in the first 2 to 3 days, how do you check that fever? First, you must unwrap the baby for 10 minutes because when you're wrapping the baby is warm. Once you unwrap the baby, then you check with a thermometer in the axilla. If the fever is above 99 or 99.5, immediately consult your doctor. No fevers are normal in a newborn baby, and it may be a very catastrophic event if you don't treat them at that particular point of time. So, friends and parents, this was a part one of our newborn care. In the part two discussion, we are going to discuss bathing of the baby, massage of the baby, and many other things we are going to discuss, which will cover even the premature babies, how to take care of them, so on and so forth. So till then, Jazakallah khair. Thank you so much.